Hello, my name is Dr. Barry Heffron, also known as Dr. Be Well. I'm a second-generation chiropractor practicing in Rockville Center for over 25 years.
All right, Dr. Barry, so we're going to talk a little bit about some basic chiropractic tips and also common questions. So my first question is, what are some of the symptoms that somebody would come to a chiropractor to treat?
Oh, I have a multitude of patients that come in for many different things. Specifically speaking, like headaches, they come in for lower back pain, neck pain, shoulder pain, arm pain, numbness, tingling, so many different things patients come with. Patients even come in with intestinal disorders and things like that as well.
Wow, that's a lot. And so chiropractic care can treat all of those symptoms?
Chiropractic care does manage a lot of different problems. It's not a cure. What it does do is gets rid of the stress on the nerves that cause many of these issues to be popping up in the first place. Instead of masking things with pills and medications, we get to the cause with the adjustments that we do.
We're hearing more and more a lot in the news and on all social media about how medicine and the medicinal world doesn't actually get to the root of a lot of issues. So in your opinion, what are some general tips? I mean, if a person is just walking around leading an everyday life, do they need a chiropractor?
Well, let me use an example. Imagine you're driving along in your car, and all of a sudden the check engine light goes on. What are you going to do? Take out a black magic marker and go over that red light with a marker? No, you're going to pull over and get the car checked out. And that's what we do also. There are many red signals that come up with patients that come in, like a little bit aches here or a pain there. And most of the time people will reach for a bottle like Tylenol or some other over-the-counter medication to treat the symptom, not get to the cause of the problem.
That's a really good analogy. It sounds like you're very passionate about getting to the root of the cause versus just treating the symptoms.
Absolutely. Getting to the cause is where it's all about.
Well, in an ideal world, people would do the opposite of what I do, which is wait until the light comes on and you know you have a problem, versus maybe address the issues and use preventative care so that in their health they won't wait until they're in pain or have some kind of symptomatic issue.
That's absolutely true, and most people don't even realize that they wait until they're 20, 30, 40, 50, even older than that. I have patients in their 90s that come to me, but I also have patients as young as their kids, infants, that come to me because their parents realized when they were starting to get back problems or whatever issues they had, that their problems started when they were much younger. That's when it does start.
That's interesting. So you recommend patients to come to you as early as
Infancy, when they're born.
So in other words, chiropractic care should be part of someone's regular health care practice?
Absolutely. My son, he's now 22 years old, has been getting adjusted since he's 4 hours old.
Wow. Well, that's pretty young.
That's young, but most people get a little nervous about that. But the techniques that we use on children are so gentle, and the kids are just so flexible, it's just very easy to adjust them.
So for more information or to make an appointment, where would we find you?
On the internet, of course, at drb-well.com, and also call my office at 516-764-2222.
And remember,
A spine online keeps you fine.